Amanda, and today I will be doing the intramuscular injection skills video for BSN225. I have gathered all my supplies here. I have my patient, my needle, and my syringe here. I have a 3 milliliter syringe, and then a 22 gauge by 1 inch needle, and I have my gloves, my medication. I am out of alcohol pads, but I'm just having extra gauze as acting as the alcohol. And these are my sharps container as well as my hand sanitizer. I am away right now traveling, so just making the videos of what I have. So next I will go ahead and verify the 6 rights of medication, which is the right dose, time, patient, route, drug, and documentation. I'll verify everything in the EHR first before I get started, and the MAR and the dose with the patient or the doctor's orders. And then I'll make sure that it's morphine sulfate, because that's what the doctor has ordered. And right now I have morphine sulfate that says 4 milligrams per ml, and according to the doctor's orders, he wants 6 milligrams for pain. And I'll go ahead and compare the providers in order in the EHR and the MAR as well. I will go ahead and calculate 6 milligrams, which is 1.5 milliliters of medication for my patient. So I'll go ahead and administer that, and I'll calculate all of that and make sure it's correct and double check it before I'll enter my patient's room, do knock, 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 do hand hygiene, introduce myself, let them know that my name's Amanda, I'll be the nurse today, and I'm here to go ahead and administer an intramuscular injection per their doctor's orders. And I'll go ahead and verify their name and date of birth. Great, they verified that. I can also check their wristband if they're in the hospital and have that. Then I will go ahead and explain the morphine injection, and should only take a few minutes, and ask them if they have any questions to let me know, and ask if they have any allergies. They have no allergies, which is great. Go ahead and verify that, and I'll let them know that I'll be administering morphine, which is for pain, but we'll go ahead and get to that in a little bit. Next, I will get started and perform hand hygiene here. Go ahead and put my gloves on. There we go. Okay, so I will go ahead and open up my syringe here. There we go. Let's take some time. Okay, I'll go ahead and throw this away in my trash there. And go ahead and open this up now. Guess I should. Okay, sorry, the gloves are a little bit big, so. Okay, put that out. Oops. And then next I will go ahead and connect this through and leave it capped. And then I will go ahead and draw up 1.5 milliliters of air. And I'll go ahead and inject the vial here. Actually, I forgot to clean my vial. So again, I'm out of alcohol pad, so this is the alcohol pad. I'm going to open the pack, go ahead and clean the vial here. I'm going to throw that away. Next, I will uncap it. I have 1.5 milliliters here drawn up. I'm going to do that. Insert the air, and then I'll go ahead and draw up 1.5. And then it's okay to draw up a little bit extra just to get all the air bubbles out. Perfect. go ahead and close this up with one hand. Go ahead and leave this right here for now. And then I recapped it, and I will double check in the EHR before I start anything. The provider's orders, the medication, the dose, and the MAR, and go ahead and let them know that I will be administering morphine sulfate today. This is just for pain. It could have common side effects of drowsiness and constipation. Adverse side effects could be difficulty breathing and hives. Please go ahead and let me know as soon as possible if those happen. You could experience slight burning at the site and tingling, which is very common. Should subside quickly. Ask them if there's any questions for me. Again, verify again my third check of the medication and everything in the EHR. Make sure I have the correct medication, the correct amount. Oh, I forgot to show you guys. There's 1.5 milliliters there. It's kind of hard to see, but there you go. And then next I will go ahead and check the placement. I'll make sure I'll ask the patient to go ahead and lie on their side and expose their hip and do some anatomical landmarks. I'll go ahead and put my palm here, put my palm face down here on the greater trochanter. My thumb will be on the groin, and my pointer finger is on the anterior iliac spine, and my middle finger will go onto the lilac crest. And then this V right here will be where I administer. I'll just use an alcohol pad for now, just to mark it, and put that there. And then I'll go ahead and inspect the spot, make sure the skin looks okay, there's no discoloration, the muscle looks good. I'll go ahead and palpate and make sure everything feels okay, and then everything looks good. Next, I'll get my alcohol pad and go ahead and clean the site about 2 inches out. Right. Go ahead and wait for that to dry, and then next I will go ahead, since I know I will go ahead and get a marker here, I'll go ahead and uncap it here, and again I'll place on the ulnar side here, and I'll go ahead and place the medication, and cleaned it, palpated. I'll go ahead and pull down, and I'll pinch and grab, and I'll place it into a 90 degree angle. And I'll do 10 seconds per milliliter, so it'll be nice and slow. Go ahead and do that. Okay, and I'll hold for 10 seconds. And then I will remove the needle, check for any bleeding, put it in the sharps container here, and make sure my patient's okay. I will go ahead and gather all my supplies, throw everything away, I'll take my gloves off and perform hand hygiene. I'll double check my patient's good. I'll give them a call light, let them know if there's anything I can do for them while I'm there. I'll document in the EHR, the right route, the right site of medication, the right medication I did, and the dose and time. And I'll double check that they're good and okay, and ask them if they have any questions. I'll thank my patient, and then I will exit. Thank you.